Hi everyone. Today I'm discussing about gas gangrene. And what is gas gangrene? What are the common causes for gas gangrene? What are the different types of gas gangrene? What is the pathophysiology and how it is diagnosed and how it is treated? We all are discussed in this topic. Firstly, we all know what is gas gangrene. Gas gangrene, which is also called as clostridial myonecrosis, and this is refers to the death of the body tissue, either due to lack of blood supply, blood flow, or a serious bacterial infection. Okay, which mainly affects the extremities, like including toes, fingers, limbs, muscles, and internal organs, which is very highly fatal and rapidly spreading infection mainly caused by the clostridial microorganisms. The causative organism is Clostridium perfringens, which is also called as Clostridium wilchi. Okay, this bacteria releases toxins which enters into blood vessels, blood cells, and muscle tissue, which causes skin discoloration, swelling, and skin blisters. Okay, which leads to the bacteria also create a gas that makes wounds smell bad when they are open. So this is all about how it affected how it is affected. Okay, these toxins also causes the widespread of inflammation also, which is very highly fatal. Okay, and how common is gas gangrene? More than 1 lakh people are affected with gas gangrene in USA. Okay, and what is the causative organism for gas gangrene? Mainly Clostridium perfringens. The other is gram-positive bacteria, anaerobic bacteria, and spore forming also. Another bacteria which also causes gas gangrene, they are Clostridium septicum and Clostridium odontolithecus, odomatians, and Clostridium histolyticum. Okay, and what is the source of infection? The main roots, they are from manured soil or cultivated soil, or from the normal intestines, or from the female genital tract. The infection takes place. And what are the causes for gas gangrene? Mainly at the recent surgical site or injury site, or from the muscle injuries or severely damaged tissues, wounds that are very deep, like high velocity gunshots. So this wound may affected with bacteria which produces toxins which enters into the blood cells, blood vessels, and muscle tissue, which leads to the skin blisters and skin discoloration. Okay, which also produces the bacteria. This is all about how bacteria affects on the skin, these deeper wounds, and also affects the immunocompromised patients and wounds contaminated with the stool also. And conditions like diabetes mellitus, arterial disease, colon cancer, frostbite, and open fractures are also affected with the gas gangrene. And contaminated needles injected into the muscles also leads to the gas gangrene. And okay, what are the less causes for the gas gangrene? There are colon, gallbladder, and abdominal surgeries, and gynecological surgeries, tumors, and childbirth and abortion. Also, less causes for the gas gangrene. Okay, what is the pathophysiology of gas gangrene? Usually, the bacteria enters into the broken site, broken skin, or wound, which in which spores are produced. The bacteria present in the circulation already, so anaerobic tissue is present. So the bacteria grow and carbon dioxide is increased, so which leads to release of toxins like lecithinase, and enzymes also produced like collagenase, protease, and lipases. See, these toxins and enzymes kill the host cell and extend the anaerobic environment and produces the gases like nitrogen, hydrogen sulfide, and carbon dioxide, which causes crepitant tissue. That means death tissue. Okay. What are the different types of toxins and their effect? Coming to the lecithinase, which causes hemolysis and dermonecrosis, and another toxins like beta toxins, which causes the necrosis of tissue. Another one is proteinase, breakdown of the collagen fibers, and hyaluronidase, and which break the cement substance of muscle cell. Okay, these all are toxins which affect the host cell and increases the anaerobic environment to cause the crepitant tissue, death of the tissue. Okay, And what are the clinical features of gas gangrene? The patient mainly said that severe pain and gross edema, and sutured wound is also under tension. Thin brownish fluid is leaked, which has sickly sweet color. That is the main prominent feature. Okay, and palpable crepitus, that means crackling feeling. When while we are touching that, there is a crackling feeling on the skin blisters. Okay, there is a color changes in the muscles and khaki colored. Okay, due to the hemolysis only, which is the patient is anxious and alert, toxic and ill, and rapid increase in the pulse rate and hypotension due to suppression of the adrenals and vomiting and low grade fever. These all are clinical features of gas gangrene. And how it is diagnosed, which is diagnosed by staining, imaging test, and biopsy. By staining using Giamsa stain to for us to know what is the type of bacteria is affected the gas gangrene, like Clostridium perfringens or Clostridia edematans, Clostridia histolyticum. Okay, and the presence of gas also said that anaerobic metabolism. And what are the imaging tests we had done? X-rays, CT scan, MRI scan to know the gas bubbles, changes in the muscle tissue, and biopsy also taken for the damage of the tissue or any other changes in the tissue. Okay, this is how diagnose the gas gangrene. Then coming to the management, firstly we debride the wound, remove the dead and damaged tissue from the wound, and then given antibiotics. They are penicillin and clindamycin to kill the bacteria, and unnecessary part is also amputated, infected part, and hyperbaric oxygen therapy. Then patient go into the particular chamber in which delivers the 100% of oxygen, which is 5 times more than the room air, which increases the amount of oxygen, heal the tissues, and slow down the infection. Since oxygen kills the Clostridium bacteria. This is how we can treat the gas gangrene. How it is prevented? By cleaning out the wounds with soap and water, and medical attention is also given when you are unable to clean completely by washing with water and soap, and keep an eye on injuries. Okay, and also wear protective wear while we are driving. Okay, the prognosis of gas gangrene is usually uh, uh, better prognosis by giving regularly monitoring, and IV antibiotics are given and monitoring the changes closely. Specific treatment we are all given, the prognosis is better. Okay, and finally we are also talk about the types of gas gangrene. There are different types of gas gangrene. There are clostridial cellulitis, single muscle type and group type, massive type and fulminating type. Why it is we are said in the last? Because we said it clearly for about each and everything. Okay, and what is clostridial cellulitis? This is a crepitant infection which including necrotic tissue, but healthy muscle is not involved, and which is characterized by foul smelling and seropurulent infection of the wound. Okay, then another one is single muscle type, in which only single muscle is involved. Group type, there is limited to one group of muscles like extensors of thigh, and in case of massive type, whole muscle of one limb. And fulminating type, which means which spreads very rapidly even beyond the limb. Intense toxemia takes place. Okay, clear? We all talk about what is gangrene, how it is common, what are the clinical features, what is the pathophysiology, how it's look like, how it is diagnosed, what are the different types of gas gangrene, how it is treated. Okay, clear? Then thank you. Thank you, everyone.